you. We'll get as many as possible on here for live answers as well as the program continues. We're just hoping to have a really good Q&A session after the presentations. Also, if you'd like to turn on live captions or subtitles, just select captions, subtitles on in your video controls. And if you want to change the language settings there, go into settings, then go into captions and subtitles, and you can choose the language you would like to see them in. And finally, before you type anything, please think carefully. We ask that you be respectful and professional in this dialogue. Keep your questions on topic for the benefit of everybody. We'll just dismiss any inappropriate content, so no use wasting your time. All right, if you have a technical problem, finally, just exit and re-enter the webinar. You'll be able to get back in. That's the quickest and easiest way to solve most of your technology glitches. We're going to publish a recording of this entire event as well after the fact on the mayor's and our city's social platforms. So without further ado, let's have Mayor Hancock kick us off with a few opening remarks.
Thank you, Teresa, and thank you to the entire panel for jumping in and being a part of this webinar. To all our, to the members of our audience, today is a opportunity for you to get a peek into the briefings, the expert briefings that I received from a very talented cadre of individuals who not only serve in their professions or in their positions of profession here at the city and county of Denver, but also have leaned in heavily to really master the data, master the trends, and master a pathway forward for the city and county of Denver as we begin to emerge through and out of this pandemic and our stay-at-home orders. I hope today that you'll get a sense of how we plan to recover. This team of individuals and professionals have been working around the clock to develop a strategic action plan for the city of Denver to recover not only as a city government and to begin to put our workers back to work with new strategic remote working strategies, but also how do we get the external part of our city, the private businesses, the small, big, large anchor institutions to stand up again and put our people back to work and begin to move our economy forward. As cities and metropolitan regions, we make up 91% of the GDP of this nation. So it is extremely important that we get revved back up and reignite our economy and begin to bring everyone back together again in a sustainable way while keeping everyone healthy and safe. And so with that, I'm very grateful to you for joining us in this webinar. We hope that you become even better informed on what the city of Denver is working on. It's a chance for you to ask even more questions about some of the decisions we're making and decisions we're going to have to make down the road. But thank you for joining us and enjoy your webinar.
All right, Mayor, thanks. Let's get started with David Gaspers. He's going to walk us through the recovery roadmap.
Thanks, Teresa, and thanks, Mayor, for kicking off this event. Once again, this is David Gaspers. I'm a principal city planner in community planning and development, also serving in the Emergency Operations Center in the recovery planning role. And so I'll be walking you through the strategic approach to the city's response and recovery to COVID-19. So, you know, when we started the process, and could I have next slide actually, of looking at the recovery from this COVID-19 pandemic, we wanted to start with a focal question, and one that had an assumption that COVID-19 will remain a threat through at least 2020. And we did that very intentionally because we aren't really doing this recovery planning process to envision an ideal future here in Denver over the next 6 to 9 months. And we're not trying to predict the future either. That can be dangerous. But we really wanted to be prepared for what's the most likely future that we face here in 2020. And that's one with COVID-19 as a threat. And we wanted to be able to take in consideration all the specific needs of Denver and our neighborhoods while envisioning how we're going to do this gradual transition from the current stay-at-home order, which is now lifting, and thinking what that next 6 to 9 months would look like. And What we now know is that some restrictions will, need to be continued to keep us safe. And as we continue to try to keep each other safe, we need to be working together so we can get back to doing some of the things we love and make Denver what we love as a city. And it's through the recovery planning process, we looked at multiple different scenarios of how the next 6 to 9 months could look. And in all of those scenarios, we identified some common actions that seemed like the city was going to need to prioritize as we respond and start to recover from COVID-19. So that's what we call our response priorities. These are things the city are going to have to be doing that may not be typically what the city business is, but what we have to be doing here in 2020. And so that's thinking about how we're caring for the sick within our hospitals. How are we continuing to prevent infection among our medically compromised neighbors? How are we trying to reduce the social, emotional, and economic disruption that is upon all of us here in Denver? How we are continuing to expand the capacity of our testing and the contact tracing. You heard a lot about that from Bob McDonald at the press conference. How are we protecting our most vulnerable community members, as well as protecting our small and minority-owned businesses, which may have the biggest impacts on them from the business community. We also want to acknowledge that the stay-at-home order and these continued restrictions do have an impact on Denver's quality of life. Let's be honest, it's hard at times, right? And we need to think about those impacts on how we can start getting back some of those things, right? And so what we're talking about here is healthcare systems, for example. It's not just the COVID-19 patients, but other healthcare needs, right? Emergency or non-emergency procedures and actions that our community members need to have done. Our access to fresh food has been hindered, as well as access to stable housing opportunities. The local and regional economy has been hit significantly through this, as we can all know. And that has impacted the city's budget and our means to be able to financially recover from this. That's going to impact us for maybe years to come. And that's also had an impact on how we are interacting with one another with our access to our parks, recreational opportunities, the public spaces that we hold dear, as well as our cultural amenities. And so through the recovery planning process and thinking about those impacts, we also need to acknowledge there's a lot of forces that impact how the city responds to the situation, right? What we call community-based response factors. And so those are things that we need to keep in mind at all times, but knowing that we may not always be in control of those, right? So community needs, what the community needs from the city at this moment, whether our healthcare system has the capacity to handle the demand, the demands on social and human services across the city, the state of the economy, not just the local economy, but ultimately the global and national economy and how that impacts how Denver recovers. And we also need to keep in mind the infrastructure partners we have. And as we start to reopen for business and return to work, are they prepared to do the same? And do they have what they need to operate? And then ultimately the cooperation amongst all of our metro and state governmental partners, so we're aligned with their thinking on these response and recovery efforts. So what we landed on were 6 indicators to ease COVID-19 restrictions. So these are how we're going to monitor and how we have monitored the decision to lift the stay-at-home order, and as we go forward, any additional lifting of restrictions. I'll run through each of these 6 indicators. Next slide, please. So the first indicator is the disease transmission stable and manageable? You may have heard Bob McDonald mention this before. And this is a indicator that we do have data that we can look at. And what we're going to be focused on here is the hospitalization rate. And is the data indicating there's a steady or declining rate of hospitalization? And we also want to be leaning on our public health experts and regional partners to make sure they're agreeing that it is appropriate to gradually ease restrictions in a phased manner. Indicator 2 we're using is health systems are able to detect, test, isolate, and treat every known case and every known contact. And so here we're talking about the ability to have enough PPE supplies, enough bed capacity, and enough staff in our healthcare system to manage the situation. And then with the healthcare system, does it have the capacity not only for COVID-19 cases, but other healthcare needs without going to a crisis care scenario? And then the testing. Do we have the kits and the centers to actually test and process up to 1,000 daily tests and hopefully above and beyond that? And then do we have the tools and the staffing trained to achieve our goals with contact tracing? So these are all things that we're going to be monitoring as we go forward. Indicator 3 is hotspots, and are they minimized in vulnerable places such as nursing homes? So it's not just the ability to identify a hotspot, but can we actually contain that outbreak and really make sure that we're trying to look out for our most vulnerable populations. That's people over age of 65, people living with disabilities, in shelters, incarcerated populations, as well as those with comorbidities. Indicator 4, and I think you'll hear more from Bob and Eric Haraga on this in this webinar, is that schools, workplaces, and other essential places have established preventive measures. So this is all the guidance and the protocols that we're laying out so everyone knows how to do this, right? So are we establishing those guidelines for private and public sectors? Do they have enough PPE themselves and sanitation supplies to keep everyone safe? We're going to have to monitor that on a regular basis, make sure that we have the supplies necessary. And also, are we supporting businesses to achieve the social distancing requirements and giving the guidelines and the support to employers so all of this can be enforced? Indicator 5 is the risk of importing new cases can be managed. I will note that this list of 6 indicators were based off of the World Health Organization's indicators. We did customize them for Denver. This is an example here where we did want to really think through the importance of Denver International Airport as a portal to the region and the world from Denver. And so we wanted to make sure we had indicators so we can establish the right measures to ensure passengers and employees are safe at DEN. And we also want to think about how we're moving back and forth between our mountain communities and the tourism and outdoor recreational activities that may be limited very early, but maybe if we do lift additional restrictions, that movement could occur more often, and do we have the right health guidelines in place? And we also want to be aligning with our regional partners all along the Front Range with these protocols and measures. And indicator 6, residents and businesses are fully educated, engaged, and empowered to live under a new normal. So this is all about how we're communicating with all the communities that need to know this information, that we're getting the messaging out, and it's going to be an effort that's going to take a long time, but we need to make sure everyone is always buying in and thinking and understanding the importance of what we're doing here as a community. And so we want to make sure that people are complying with the guidelines and the restrictions, and they understand why. We also need to acknowledge that a lot of work has been done. It's been amazing that this has only been about 2 months really when this hit Denver and the state of Colorado, and there's so much work has been accomplished already. We have achieved increased bed capacity. We have obtained, I think, millions of pieces of PPE. We've established new auxiliary shelters. We have increased our ability to test both COVID-19 and antibody testing, and we've had extensive collaboration across the region as all of this has unfolded. And so what does that all mean going forward? I think the mayor really outlined the phase transition in the press conference quite well. This is a slide that speaks to that idea that, you know, we have this initial phase where we're going to be moving from this broad-based stay-at-home order to more targeted health measures that continue to promote the health and safety of Denver residents. And if COVID-19, the situation continues to be stable and manageable, that we can consider lifting additional measures on a monthly basis. And we don't want to lift those too early without good data behind them, but we want to continue to use those 6 indicators as we go forward. And that's acknowledging that at any time that if we start to see a trend in the wrong direction, that we may need to reinstate restrictions to ensure that we keep down in our resurgence. So the first phase, and this will be where we'll go into more detail here, but the continued wearing of masks. We know that there's a public health order starting tomorrow with that. You're going to continue to see that practicing of social distancing. The recommendation to continue to work from home whenever possible is important. Large gatherings will still be restricted, and then businesses and industries will be operating at a reduced occupancy going forward. And at the end of the day, we need to think through how the city can help everyone in Denver thrive, right? We have different vulnerable populations that we need to really put at the forefront of our thought and have that equity lens on this entire effort. And so we want to be thinking about how we can be reducing barriers for small businesses to re-enter the economy. How are we helping some of our most vulnerable neighborhoods with food supply and economic assistance and housing stability, the availability of childcare for many of our workers, providing training or retraining for employees to assist in the mitigation of COVID-19, providing technical assistance for small businesses so they can actually achieve a work from home model, and allowing them to keep that social distancing in their office by keeping more of their workers at home. And then finally, helping businesses access the state and federal funding resources, as well as advocating for those additional funds. That's it for our strategic recovery roadmap. I'll throw it back to
David. Perfect. And I'm really, before we move on to our next presenter, David, we're getting a lot of questions, and I think you can just quickly answer this for us. As you talked about the phasing here, we're getting questions about libraries and rec centers, and maybe you can give just some context around how those kind of places will fit into the phasing.
Right. Yeah. So they are not open on May 9th. So they're not part of this first phase, but they could be a part of the next phase of reopening the city. And we'll want to make sure we're aligning with our state and regional partners with that. And so we'll be monitoring the data, those indicators, and if it aligns with our state and regional partners, that those could be lifted in the future.
Okay, and let me bring Deanne in from the city attorney's office. And Deanne, maybe you can also give us a feeling to broaden that out, a reminder about where we are with mass gatherings or large gatherings. And we've gotten a lot of questions as well, and thank you for those of you submitting your questions about festivals and, you know, the kind of things that we look forward to in the summertime, in addition to libraries, rec centers, those kind of bigger gatherings. Maybe you can just give us a reminder on where we are with that and what we can expect.
Sure. So mass gatherings are still prohibited if they're over 10 people. So you can have gatherings up to 10 people after May 9th, but until May 26th, the 10-person limitation is going to be in place. The city and the state are still going to be looking at what opening they'll be able to do after May 26th, but festivals, concerts, things like that, gyms are still not going to be available through May 26th.
All right, let's bring in Bob McDonald, Executive Director of DDPHE. And Bob, we'll let you talk a little bit about how health data is informing all these phases of recovery.
Yeah, thank you, Teresa. So Bob McDonald, Public Health Administrator for the City of Denver and the Director for the Department of Public Health and Environment. I want to thank you, David, for setting the stage to talk about probably two of the more important of the 6 indicators in terms of how we make decisions to go from one phase to the next. What you're looking at here is data that our partners at Denver Public Health collect on our behalf so that we can make these informed decisions. This is a graph that shows the admission rates, hospital admission rates with COVID patients throughout Denver. You can see the number of admissions on the y-axis, and then of course, day-by-day case on the x-axis. The blue line is cumulative number of cases over time, and so because it's cumulative, as you might guess, that number is going to continue to go up. What's more important is that stabilizing of the number of cases that are moving into a hospital setting for treatment. And you can see very early on, around the middle of March, when we started this journey with COVID-19, you can see that hospital admissions went up steadily around March 16th through the 28th or so, and then it started to decline. Our hospital partners have done a good job at trying to build out capacity to take on more cases if needed, but the admissions rate remains very stable. I was looking at some data earlier where there are hundreds of ICU beds that are still available in Denver, hundreds of ventilators that are still available, and thousands, literally tens of thousands of pieces of PPE that the city has set aside to deliver as needed to our medical partners. Towards the tail end of this, I'm sorry, Teresa, I was just going to mention something on the previous slide, but we don't need to go back. Okay, on the tail end of this, you'll see that you see 2 and 0 and 0 towards the end there. That's just a reporting function. Those numbers will probably creep up a little bit. There's a delay with reporting, but this is a good chart. I think this is probably one of the more important pieces of the puzzle here in terms of how we make decisions moving forward. There is no way that we could entertain easing up on any restrictions if our hospital, our medical community was struggling with managing the cases that they have now. Another piece of the puzzle is this right here, the number of cases that we see on a daily basis. And again, you see that orange curve continuing to climb, but as you would expect, that's going to continue to climb. These are cumulative number of cases. What's more important are the blue bars on the bottom along the x-axis there, and you can see that in the first few weeks there was a slow but steady incline up through about April 4th or so, and then it dipped a little bit, went up and dipped again through the middle of April. You see a couple of small spikes around the later part of April, April 24th, right around that time, but that's due to some outbreaks in various venues. But then again, right after that, you see it stabilizes. I get asked a lot about this data, asking, well, I get questions about the number of cases. They're still pretty high, or the number of cases have gone up in April compared to March. A couple of things that's important to keep in mind when you look at this data. One is that you would expect the number of cases to go up as testing capacity goes up. That's the very reason that we don't look at just one metric. You have to couple that with available PPE. Is that stable? You have to couple that with hospital admission rates and their capacity to handle more cases. So this is some very stable data here. A second question that I often get with this data is the number of positive cases in relation to the number of cases being done is still fairly high. Again, the focus has been fairly early on with the limited number of tests that could be administered. We had to focus, and still to some extent are focusing on those that have symptoms consistent with COVID-19. So you get what you test for. If we're focusing on testing people who are going into a hospital setting to be treated for symptoms consistent with COVID-19, and that's the majority of who's being tested, then the positive rate is going to be fairly high. As we build out capacity to do more testing, then I would expect that number will decline. So these are very important pieces of the puzzle here. I was asked a little bit earlier, how do you decide when you need to back up with what's been lifted, or how do you decide when you need to move forward? Well, we look at those indicators that David had mentioned, And generally speaking, if we ease up on some of the restrictions, if we see case numbers and hospital admissions start to increase consistently and significantly over a 5-day time frame, then we need to act quickly on that and look at buttoning things up a little bit. On the other side, if we see over the course of 30 days that things are still stable, then we can start to talk about easing up other restrictions. And the reason we look at a minimum of 30 days is to cover the incubation period for this virus and to give time to that 14 days, give time for that data to come in, for it to be analyzed, to have conversations with stakeholders throughout the city about what that next phase might be. So that's how we manage this moving into this next phase, and we'll continue to keep an eye on these two indicators and the other 4 that David mentioned. And with that, I'll turn it back to you, Teresa.
Thank you, Bob. And Bob, I have a question. This is from one of the folks tuning in with comments to the webinar saying, what does frequent disinfecting mean? So when we talk about frequent disinfecting, give us a little more specifics on that.
Sure. Well, one of the things that we have going for us with this virus in comparison to other organisms that we sometimes deal with in the public health department is not very hardy. So general cleaning and sanitizing, much like you might see in other settings, restaurants and others, it is not going to withstand that frequent cleaning and sanitizing. And so those products that you often can purchase just from common retailers, supermarkets, those are going to do the trick. In terms of how frequent, I don't know that I can answer that. What I can suggest and say with certainty, the more frequent, the better. It's going to have a lot to do with the way employees navigate through an office setting, how many common surfaces that they touch. It's going to have a lot to do with that. It should be done throughout the day as much as possible to the extent that it can be done in the various settings that we're trying to implement those environmental controls. So multiple times a day, if not hourly, if possible.
Okay, thank you, Bob. And before we jump to our next presenter, I have a question for Dr. Price, please. And again, this is coming in on the chat. And Dr. Price, the question is asking about the testing that's being done and if it identifies other mutant strains.
Yeah, so the testing being done will identify COVID-19. It's not a perfect test, it never has been, but even if it's mutated, it will still pick up the virus.
Dr. Price, thank you so much. And now we're going to shift over to Eric Haraga from DIDO. He's going to talk about economic recovery. Take it away, Eric Haraga.
All right, thank you, Teresa. Good afternoon. Thank you for allowing me to speak today. I'm here to speak more specifically about how we are planning for economic recovery in Denver and how the Economic Relief and Recovery Council will play a critical role. On the next slide, my colleague David Jasper just took you through the city's roadmap to recovery. So this is a familiar slide. I'm not going to go through these pillars again. However, I wanted to point out that we are approaching this as a collective team across the city. This work will be shared across agencies to help everyone in Denver thrive. And as the mayor announced earlier, we have stood up the Economic Relief and Recovery Council to hear from the business community and hear from those that are on the ground to help alleviate city regulatory requirements, help financially, help the workforce, help provide resources so they can continue operating in this post-COVID world as we are reopening. Next slide. As we all know, COVID-19 has had a significant impact to Denver's business community, and it's important that the city leverages the experience and insights from across the spectrum of public, private, and philanthropic sectors to put forward innovative ideas and to accelerate our economic recovery. The Economic Relief and Recovery Council that we have developed is an advisory group created to provide strategic recommendations to the mayor and the city's executive leadership on how to mitigate and prevent further negative impacts. Their insight will help us really to accelerate future growth of Denver's economy and businesses through an equitable lens. As we formed this council, it was important for us that this effort was a private sector-led effort, given the importance of understanding challenges of businesses of all sides across industries, sectors, and neighborhoods. COVID-19 has had a significant impact, and now more than ever, the city will need to rely on business and nonprofit leaders across the city to better understand how we can immediately affect relief efforts and how private sector viewpoints can really provide better guidance for long-term actions in order to ease regulatory burdens, provide better partnerships to the private sector that is rapidly changing and adjusting to this new economy. So to that end, we have put together these 5 committees you see on the screen. It spans small, medium businesses, large employers and anchor institutions, construction and development, restaurants, entertainment, arts, culturals, and hospitality. Strategic partners is the 5th category that is being formulated right now. And with all this more work, we are being mindful to really reach our most vulnerable communities. We have received an overwhelming response from the community with a common purpose to get Denver back on its feet. We are grateful for the committee chairs and the committee members for dedicating their time and effort. I'd like to once again thank Lori Davis, Grant Thornton's Denver office managing partner, for stepping up and really leaning in to lead this important game-changing work. Lori has worked across many industry sectors, and she has the passion and care for the community that we need, and that makes her the ideal candidate for this role. As you can see on the screen, each committee has 2 chairs, and I'm grateful to work with such talented people who care about making a difference for the city. The committee members are still forming in some aspects, but they are already forming and meeting at the same time, and they're already providing recommendations. The approach by the city and the ERRC is to look at rebuilding Denver's economy in 3 phases. Urgent relief, that's where we are today, and we are in this period, and we continue to deploy resources such as our business relief grant programs. We're working with our sister agencies like finance that's doing what they can on sales, personal property, sales tax deferments. There are many strategies out there that we are just trying to deploy quickly to our businesses and residents. And of course, stabilization. We are, with today's announcement, with the roadmap to recovery and Denver's stay-at-home order announced and the partial reopenings, we are heading and beginning that journey towards stabilization. And of course, long-term recovery is really what we are striving for. So I'm just going to highlight a few of the efforts to date right now that have been implemented since March. Most recently, we announced the first $2 million deployment of our small business emergency relief grants. We provided 290 small businesses grants up to $7,500, many in our most vulnerable neighborhoods. In a given normal year, we grant about 30 to 40 grant awards annually. To push out 290 over the past 3 or 4 weeks or so has just been an extraordinary effort, and we are now accepting applications for our 2nd round. Our workforce centers went digital the day we had to close them due to the stay-at-home order, and we have served over 1,800 people virtually through our now hiring calls, virtual job fairs, and Workday Wednesday webinars. We have also been collaborating with our partners at the state and working across the city, across city agencies to eliminate red tape and creating a more efficient business regulatory environment. And now we are working closely with various industries through the ERRC to get insight on business reopening strategies. While we have been focused on short-term relief and on how we safely reopen businesses, we are also developing plans for economic stabilization and long-term recovery, specifically looking at service gaps, identifying what resources already exist, where the city can either enhance or fill a gap in services that would support economic recovery. In terms of operations, how do we create a more efficient regulatory environment for businesses trying to get on their feet? For example, again, cutting the red tape and looking at that impact. Labor, workforce, what does the new workforce look like? What skills training is needed or retraining is needed? How can the city and partners provide the resources needed to get people back to work? Intergovernmental coordination, coordinating with state, regional governments, and ensuring we are leveraging state and federal resources to their fullest and identifying federal policies that are essential for recovery on the city level. And social responsibility, really working with corporations and foundations who have the capacity to support Denver's economy and recovery, helping to align philanthropy with community needs. Well, it's early in the conversations in terms of the ERC formulation to share a lot of specifics. Here are just a couple of examples of programs and policy ideas that we are exploring. Supporting retail and restaurants with managing the social distancing mandate. We know that social distancing can be challenging for both retailers and restaurants, and we are looking at how the city can temporarily ease policies and would help them adhere to this mandate and protect the health of their staff and their customers while also operating. Training and retraining workforce for construction or other trades jobs in high demand. This is what our workforce development service shop does. Our construction careers program in partnership with Work Now are primed to help with construction talent pipeline. And at the same time, we are looking to expand our small business emergency relief grant program to help more small businesses. There's many ideas in the pipeline right now, including, and this was discussed earlier, but how can we provide more PPE to small businesses in low and moderate income neighborhoods? I know there's dozens of ideas being formulated by each committee, and we're excited to get back to this group and report out on that. So in closing, Denver came out of the 2008 recession faster and stronger than most cities in the US. And with the help of the ERC, we will achieve that again. So thank you for your time. Teresa, I'll turn it back to you.
Thanks, Eric. And I'm going to go to some of the questions that we're getting up in the chat right now. And I want to go to Dr. Greg LeBerge, if we can, from Denver Police Department. And I would ask you, Greg, if you can, just maybe share a little bit about your work with antibody testing, et cetera. The reason I bring this up is because we have a great question from Susan about concern about people, the fact that people haven't had this, most of us haven't had this virus. And the concern that if people aren't taking some of these steps that have been outlined and described in detail, if we're not taking these things seriously, that people are still very vulnerable in getting this virus. And I thought you would have a unique perspective on that, given some of the testing that you've been doing.
Sure, happy to answer that. About a month ago, a little over a month ago, when we first heard of COVID, our main concern in public safety was to keep our workforce out there and working. At the time, we were really facing two things. We were facing fear and symptoms. People had symptoms that they didn't know if it was COVID or not. We're in the middle of flu season or at the end of flu season. The allergy season is beginning. There are a lot of symptoms that are shared with COVID. And so people are very fearful about symptoms. And we were also very concerned that we could keep our public safety officers in the sheriff's department, the fire department, and the police department working. So we started an antibody testing program to try to survey the workforce, to try to get an idea of, well, how widespread is this, and where should we look in our workforce of 4,400 to see if we're picking up any COVID-like activity to start. So we've been doing that for about 5 weeks now, and we certainly identified work groups that had more cases than others. And working in partnership with Denver Health, we worked as a two-step process to establish not only a presumptive test using antibodies, but a confirmatory test for the presence of virus through Denver Health, and we worked in partnership with them for that. We continue to do that today, but we've pretty much identified throughout public safety the areas we're most focusing on in terms of clustering. It's called clustering of cases. But I would say that we don't see a huge amount of people with COVID. I don't think it's a very widespread thing yet. I think that is why you hear the advice coming out that it's still possible and could spread, and you're hearing the advice about wearing masks and taking a longer term approach, a marathon versus a sprint, in terms of protecting the community by protecting yourselves and protecting your neighbors. And I think that's good advice. As we roll forward, there are a lot of unknowns, as other people have mentioned, when it comes to this virus. It is a form of SARS, is SARS-2, and I think it's something that we all as a community need to be aware of moving into the summer months. The weather may not clear it up for us. I think our behaviors are key to mitigating the spread and allowing our health professionals to be able to mitigate whatever happens in the future. So I think following the advice that's given by the mayor and his leadership team is wise. We certainly are doing that in public safety so that we can have our police, fire, and sheriffs on duty. And we've had less than 1% of our people have a problem at this point.
That's great. Thank you so much. I appreciate that. And this one will go to either Bob McDonald or Dr. Price. And Bob, I'll start with you. But just a clarification for folks who will be testing their employees' temperatures, taking temperatures as their employees are coming into work. This is one of the requirements that is in sync with the state. The question is, what if someone's coming in from outside and they're warm, et cetera? They're wondering about how long do you have to wait to retake the temperature again if someone's just coming in from outside, or what are some more specific protocols around that to get accurate readings?
Well, it's an excellent question. Every day we walk into the EOC, the city's emergency response center, and in the early stages, we were walking in with very cold skin, and people are taking our thermometers with a non-contact forehead thermometer. And many times it raised low because, having just come in from the outside. It's an excellent question. I don't know that there's a clear-cut answer for that. It's going to depend upon how warm a person is and, where they've been, what they've been doing before they walked into a venue to have their their temperature checked. I think it's important to be aware of that. But if something reads very high or reads very low, then I would encourage those that are taking that test to wait a few minutes here until a person's temperature can stabilize a little bit. Because it's a very good question. People can get a false reading depending upon what the person's been doing before they had their temperature checked. And I don't know if Dr. Price has any more that she could add to that, given her medical background.
Yeah, not a whole lot. Usually the problem with the environment affecting your temperature check comes with the colder temperatures and you're coming in from outside, and it might suppress a higher reading, but it's not as common in the warmer temperatures. I would say if you're coming in from a 90-degree day and you get a high temperature, it's reasonable to recheck it in 5 minutes, but I would believe it, and that person should be instructed as directed by you, Bob, on where to go after that.
Thanks, Dr. Price, and thank you, Bob, for filling us in. I want to get a question to Mayor Hancock, if I can bring him back into the conversation. A lot of you are asking questions around things like summer camps and recreation centers and your yoga classes and your trainers and your special events. And Mayor, I thought it would be helpful. I know that we just announced this first phase, and now we've got all the next set of questions about the next phase, right? And when we will know and when we will. And I think it will be helpful for people to understand all the factors that you are balancing, not only just the health and safety aspects, but the coordination with our state government, our regional partners. I mean, there are so many factors when it comes to these larger gatherings or these kind of spaces where we interact. If you want to talk a little about that. Yeah,
Teresa, but no greater factor that we look at than how do we keep people safe, right? and exercise social and physical distancing in a way that will keep people safe, including our children. And listen, I'm a father, and thankfully my children are older now. They're not going into summer camp, so we don't worry about summer camps as much as I know many families around Denver are having to worry about what they'll be doing with their children this summer, particularly with recreation centers closed and libraries closed at this point in time. We want to see these avenues and institutions open as much as you do, for the same reasons. We want your children reading, we want them to recreate during the summer, and we want them to be able to engage in a lot of other activities, as well as to make sure that there's safe, healthy places for them to go for the summer months. But we have to take the health and safety first, and to begin to roll this out slowly. As much as I want to give you answers that on this day we're going to be able to open these things, we have to be cautious. And unfortunately, I don't have those answers yet until we're able to see, one, how we're complying, how the measures we're putting in place begin to give our public health administrators and medical professionals the confidence that we can open it up even more and have greater capacity. Now, with that said, there may be a time where we are able to say, camps can open, however, it won't be for the amount of capacity that you normally have. You might be used to having 30 kids. Well, this summer, you will only be able to have 20 kids, or 50 kids, and this summer you're only going to have 30 kids. So the reality is that there's going to be some regulations in place, and I'll finish on this. I said this in the last press conference. This is going to be a different summer than we're used to. Concerts, festivals, summer camps for our kids, all the activities that we are used to, either going to be scaled back greatly or not held at all. And I would prepare now, if it were, me and my family now, to manage through the summers with a lot different landscape than we're used to. So, not really able to answer the question, but to give you kind of the transparent, very direct conversation that we're having all over the city.
And Mayor, as long as I have you, because we only have a few minutes left, and there are a couple of themes that are coming up a few times that I want to get to. One about our smaller businesses that are still closed and struggling. The other one is about a phrase that we kind of take for granted in the mayor's office and at the city and county of Denver, which is putting things through an equity lens. When we say that, and I know David Gaspers in his presentation talked about the equity lens, not everyone might understand what that means. Department to department, plan to plan. Can you share a little more about what that means?
Yeah, it really means taking a step back and really asking ourselves the question and allowing ourselves, or really forcing ourselves to analyze how certain decisions we're making impact different groups. And I mean, COVID, a perfect example of really understanding equity. We have health disparities that have been part of our society for decades, generation after generation. A lot of that has been exacerbated during this pandemic. It's hit communities of color, African Americans and Latinos, much greater than it's hit other demographics proportionally. And so we have to ask ourselves, one, how can the decisions we make, how can they help lift and protect those demographics even more than others as we go forward? How do we, we're going to open up shelters, make sure that they're ADA compliant so that people who are in wheelchairs, people who may be hearing impaired, sight impaired, can navigate safely. Equity means looking through a lens that says not everyone is equal. And even if they were equal, based on maybe cultural backgrounds, health disparities, they may respond differently to whatever decision you're making. And so we've got to take into account how our decisions may impact certain demographics. That's really what equity does. Thinking about those things early so that you don't have to try to correct disastrous results later on. And I can tell you that our inclusion and equity team have been embedded in our Emergency Operations Center very, very early on to help guide some of these key decisions.
And Mayor, you might want to weigh in on this, but it might be one for Eric Haraga as well. We're hearing from also smaller businesses, people who are struggling right now, who have yet to receive help because there just isn't enough to go around for everyone, right? Whose employees have not gotten their unemployment checks yet, who are very concerned about how and when they're going to be able to reopen or if they're going to make it at all. And you yourself said earlier, Mayor, we got to keep it real about this stuff, right? I mean, this is tough times for our city in more ways than one. What can we say to those folks that are feeling this uncertainty, that are trying to keep themselves safe, watch out for their employees, but are really teetering on the edge of whether or not they can go forward?
Yeah, I appreciate it, and certainly sympathize and empathize with small business owners and employees and employers. And I've spent some time, unfortunately, even with family members who have had to navigate the same challenges with regards to the unemployment system and the the PPP program for their small businesses. It is very difficult. There are no easy answers out there other than to keep trying, keep your head up, keep moving forward, trying to address our complete applications online. And in the meantime, we're going to try to continue to move barriers out of your way to get that accessibility to you as quickly as possible, as well as to make sure social safety nets are available and easy to navigate as well. Those who may need assistance around food security, assistance with rent, our TRUA program in the city of Denver, making sure that we kind of remove those barriers and try to respond as quickly as possible. And if we can, fortify those funds so that folks can get to them much quicker, making sure that information is available. Eric may want to talk about it, but he'll tell you that when we offered the small business support here in Denver, we were oversubscribed. The response was amazing. I could not imagine the staff having to go through every one of those applications and make the very tough decisions on who was going to be funded and who wasn't. And then unfortunately at the federal level, we had a situation where the bigger boys got their bite at the pie faster than small businesses, small and medium-sized businesses. So I'm glad a third stimulus package was approved so we can get to smaller businesses, and Eric is getting ready for a second round. And again, we have a social safety net system that is set up at denvergov.org through our human services department to help respond as well. Eric?
Yes, thank you, Mayor. So you are correct. In terms of the first 2 million served 290 businesses. We have another 2 million in the second round, but really we are only touching about 10 to 15% of businesses that are actually applying for these loans. But I encourage you to reach out to our office, Economic Development Agency on denvergov.org. We would love to understand your circumstance. We do offer technical support. We have nonprofit partners that we partner with and can connect you to resources. In addition, we have our workforce development shop in addition to the resources that the mayor had lent, but truly sympathize with some of these small businesses, and we are doing as much as we can, as fast as we can, and we hope we can do more as future stimulus funds or CARES Act funds are deployed by the federal government.
Eric, thanks. And Mayor, before we close out, just any final thoughts for the folks who joined us on the call?
Yeah, let me thank the panel as well for taking time to be a part of this, and to everybody who joined in. I hope this is helpful to get some of the deeper, get a deeper understanding of some of the issues that I listen to every day, again, from this expert group of people who advise me on helping to make some of these tough decisions. They're not easy by any stretch, but we are focused on balancing, protecting the health and safety of our residents and reigniting the economy and moving forward. I'll finish with the way we started. This is going to be quite the marathon. Slow roll to go fast, but as a city, we are committed to doing what we need to do now so we can do what we want to do down the road. And if we all remain committed to that by wearing our masks, practicing social and physical distancing, washing our hands, keeping sanitizer safe and close for ourselves and for our employees, we're going to get through this, and we're going to continue to remain on this side of the epi curve, the place that we have fought for, and hopefully continue to see a decline, particularly as we beckon the season of the flu coming on. We don't want to see the spike in the COVID and the flu season simultaneously. We've got to be prepared to protect one another. When you wear a mask, you're protecting me. When I wear mine, I'm protecting you. Let's care for one another. Let's enjoy our day, and let's take care of each other.
Mayor, thank you so much, and I want to thank everyone who joined us today. If you missed part of this, we are going to post the entire thing. You'll be able to share it. We'll publish the recording of the event on the mayor's platforms as well as on our city platforms. And if we didn't get to answer your question specifically, please trust that we are going to get all those questions in the chat queue, and we will get those answered to you just as quickly as we can. Stay safe, keep calm in Denver on. Thanks for being with us.